Epilepsy, a condition that affects millions worldwide, but often remains misunderstood. In today's video, we're diving deep into everything you need to know about epilepsy, its causes, symptoms, treatment options, and how to support someone having a seizure. Let's get started. Epilepsy is a neurological disorder where brain activity becomes abnormal, leading to seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. It's one of the most common brain disorders, affecting over 50 million people globally. Seizure occurs when there's a sudden surge of electrical activity in the brain. Think of it as an electrical storm, brief but intense. While not every seizure means someone has epilepsy, having two or more unprovoked seizures usually leads to a diagnosis. Seizures are classified into two broad types, focal and generalized. Let's break them down. Focal seizures, also called partial seizures, originate in one area of the brain. They can be focal aware seizures, where the person remains conscious but may experience sudden emotions or sensations. Focal impaired awareness seizures, where consciousness is affected and the person may seem dazed or confused. Generalized seizures, on the other hand, involve both sides of the brain and include tonic-clonic seizures, also known as grand mal, with full-body convulsions. Absence seizures, brief lapses in awareness, more common in children. Epilepsy can affect anyone, but certain factors increase risk. These include genetic influence, head trauma, brain conditions like tumors or stroke, infectious diseases such as meningitis or encephalitis, prenatal injury, and developmental disorders like autism. However, in over half of all cases, the cause is unknown, what doctors call idiopathic epilepsy. If someone experiences a seizure, doctors don't jump to conclusions. A full medical evaluation is essential. Diagnosis typically involves a detailed medical history, neurological exam, EEG, electroencephalogram, to detect abnormal brain activity, imaging tests like MRI or CT scan to find structural issues. A diagnosis helps classify the seizure type, which is crucial for proper treatment. While there's no universal cure for epilepsy, treatment can help most people live seizure-free. Treatment may include anti-seizure medications. These are the most common and work for about 70% of patients. Surgery, for those with focal seizures that don't respond to medication. Vagus nerve stimulation, VNS, or responsive neurostimulation, RNS, devices implanted to control brain activity. Ketogenic diet, a high-fat, low-carb diet especially effective in children. And finally, lifestyle changes, like managing stress, getting enough sleep, and avoiding seizure triggers. Living with epilepsy. Living with epilepsy can be challenging, but it's entirely possible to live a full, independent life. Here are a few important tips. Stick to your treatment plan. Identify and avoid triggers. Always wear medical ID. Educate family and friends about your condition. And stay connected with your neurologist. Support from the community and family makes a huge difference. Let's talk about something critical: how to help someone having a seizure. If you see someone having a tonic-clonic seizure, 1. Stay calm. 2. Time the seizure. Call emergency services if it lasts more than 5 minutes. 3. Protect them from injury. Move sharp objects away. 4. Place them on their side to keep airways clear. 5. Do not put anything in their mouth. 6. Stay with them until they're fully awake. After the seizure, they might be confused or tired. Offer reassurance and help them get medical attention if needed. Despite being common, epilepsy is often misunderstood. Misconceptions can lead to stigma, discrimination, and isolation. Epilepsy is not contagious. It doesn't mean someone is mentally ill or possessed. And it definitely doesn't define a person's intelligence or potential. Awareness and education are key. The more we know, the more inclusive our world becomes for people with epilepsy. Epilepsy is just one part of a person's life. It doesn't define them. With the right care, support, and knowledge, people with epilepsy can thrive. Thanks for watching. If you found this video helpful, give it a like, subscribe for more health content, and don't forget to share it to spread awareness.